Hi, my name is Preston Satoris. I am currently a fourth year medical student, and I'm here today to talk to you about adverse childhood experiences and maybe take a look-see into how that affects them when they become older. This presentation is part of a video library series developed to create a resource to help provide providers and personnel support young children with or who are at risk of social, emotional, and behavioral problems. I hope this video helps you, and without further ado, let's get started. First, I'd like to acknowledge the slides were originally developed by Arthur S. Leitsky, or Leitsky, I hope I'm pronouncing that correctly, and edited with their permission, so thank you again, Arthur. So, learning objectives. What we want to do is we want to look at a specific study called the CDC Kaiser Adverse Childhood Experiences Study. Some of this can get a little detailed, but hopefully I can make it simple enough for anyone to understand. In addition to that, we're going to link past ACE data. ACE is just the acronym for Adverse Childhood Experiences. Data with current behavioral risk factor surveillance system. So that's going to be the current system in which we look at different risk factors. We also want to provide updates on the prevalence of different ACEs. We want to understand why some individuals are at a higher risk of experiencing these ACEs. So first, let's kind of track it chronologically and begin with the original study. So this original study was titled Relationship of Childhood Abuse and Household Dysfunction to Many of the Leading Causes of Death in Adults. So this was originally published in 1998 by Vincent J. Felitti, MD, from Kaiser, and Dr. Robert F. Anda from the CDC. So what they did was they looked at 17,000 subjects surveyed between 1995 and 1997, so around 2 years. They wanted to look at several types of different traumas. These patients were continued to be followed and for more than 20 years later. Data resulted in more than 70 research papers published since 1998. And this developed the Adverse Childhood Experiences module. So the ACE module, first again, ACE is an abbreviation for Adverse Childhood Events, is basically an exposure to one or more of the following categories. I'm going to walk through it with you right now. So these 11 questions were divided into 8 categories, giving us an ACE score of 0 to 8. So 3 questions or 3 categories we had were 3 for child abuse, which included emotional, physical, and sexual. 5 for household dysfunction, substance abuse, mental illness, domestic violence, criminal behavior, and parental separation or divorce. So what the original study found was that greater than 60% had at least one ACE, or adverse childhood event, before age 18. And you can see kind of the breakdown of this here. 26% had one ACE, 16% had 2 ACEs, 9.5% had 3 ACEs, 12.4, 4 plus, and only 36% experienced 0 ACEs. 64% had at least one. So it's a pretty striking number. They found that abuse, physical, was the most common of that kind of abuse. In terms of household challenges, substance abuse, mental illness, and divorce were of the most common. And as far as neglect goes, emotional neglect is the most common. And you can see the breakdown of the different categories here in the graph. So what we found was more adverse events as a kid increases chance of adult psychopathology. People who experience one adverse event are statistically likely to experience 2 or more adverse events. And thus, when they have 2 or more adverse events, there begins this synergy. Synergy is basically when the combined effect of 2 or more adverse events becomes greater than the sum of their individual effects. It's almost as if the 2 adverse events kind of build upon each other. Here they defined complex adult psychopathology as having diagnoses crossing 2 or more what's called DSM diagnostic categories. Examples they looked at included mood, anxiety, substance abuse, and impulse control. So how ACEs work. Here we've kind of made a diagram that tracks adverse childhood experiences, details impact on childhood development, and what can lead later. So we can see certain examples. I'm not going to read them all. You can pause and read if you would like. But things like abuse, whether it's psychological, physical, or sexual, or household dysfunction, domestic violence, substance abuse, mental illness, can lead to neurobiologic effects, psychosocial effects, and health risk behavior. So what are those? Neurobiologic is like brain abnormalities and stress hormone dysregulation. Psychosocial, again, it's kind of in the naming, poor socialization. Health risk behaviors means you're more likely to smoke or maybe eat more or abuse substances. These can lead to future disease and disability. So what do I mean by that? I mean different pathologies such as major depression, suicide, PTSD as examples of mental diseases. Again, if you're smoking, if you're doing more drugs, this can lead to future abuse, which has an effect on your body as well. Heart disease. And again, the rest listed here. This can also lead to social issues. Again, when you have these kind of experiences plaguing you, plaguing your mind, and also having a deep effect on how you see the world, your perspective as you're growing up, it can lead to different problems such as homelessness, prostitution, criminal behavior, and many more. Another study touched on in the learning objective was behavioral risk factor surveillance system. So what is that? Basically, they did a survey of 214,157 respondents, and they different ACE categories based on demographics. So what they did was they looked at age group, race, ethnicity, household income, how they attained education, how they attained employment and employment status. Last two are sexual orientation and just the region of census. So what happens is what they did was they looked at California and collected data from there. The California Surgeon General, Dr. Nadine Burke-Harris, pediatrician, was the one that was kind of accumulating this data. What this kind of led to was moving towards universal ACE screening. So always kind of looking at when a kid comes in, have they had any adverse childhood experiences? You want to be able to, as a physician or as a provider or some sort of care for the child, stop this before it further detriments their lives as they grow up. So this study found that emotional abuse was actually the most common ACE. Second most common was parental separation or divorce, and third was household substance abuse. So you can, just reading this, you can kind of imagine, yeah, maybe growing up with that would affect your worldview or affect how you deal with certain issues. What they found actually was within female respondents, there was a higher prevalence of child sexual abuse in their history, household substance abuse, and household mental illness. So all around, just very depressing stuff. Groups with the highest level of overall ACE scores were women and young adults, multiracial, people who had incomes less than $15,000 per year, or those with different sexual orientations, such as gay, lesbian, bisexual, and many others that are just as valid but are not listed here. So you can see just basically people who are different, people who don't fit the stereotypical Caucasian cis male can be very prone to higher adverse childhood events. And that's unfortunate. So the conclusion of this study was that ACEs are prevalent across all demographic characteristics. However, it is clear that some populations experience a greater unequal burden, and these social and structural conditions contribute to the risk of exposure to childhood adversity. Doing the study, it's always important to speak to the limitations, things that they could have improved, or things where they couldn't do as much as they wanted to. So, to start off, retrospective data was based on self-reporting. Whenever you have someone self-reporting, it's always prone to subjective biases or recall bias. So what is recall bias? Recall bias is you're trying to recall either an event or a certain aspect of your life that is being used as a data point for the study, but sometimes you're misremembering, right? So that can be that can lead to some inaccuracies, and so obviously that's a limitation. There could also be over or under reporting of health risk behaviors and diseases. So maybe they are leaving out certain aspects of their lives that they don't want us to know. Even if it's anonymous, they don't want us to know. They don't feel comfortable sharing. There's also lower number of childhood exposures reported by older persons. So I guess you could assume maybe they feel like they're past it, they don't want to talk about it, they don't want to reach out about it. It's hard to say definitively, but this was a trend that was seen in the study. In addition, you can only really demonstrate associations. So what this means is you can't say that this definitively caused this, right? So these ACEs definitively caused their smoking, their drug abuse, their homelessness, their diseases, right? You can't make that A to B connection. All we can make is kind of inferences. We can say, hey, it makes sense that this would lead to this, or this has some sort of connection to this. In addition, other risk factors were not examined. There could be some confounding variables. And so that's obviously another limitation of this study. And so here we have another kind of pyramid, another image showing how adverse childhood experiences from birth can lead to social, emotional, cognitive impairment. That then leads to adoption of health risk behaviors. That then leads to disease, disability, and social problems, and then finally early death, unfortunately. So again, this is why adverse childhood experiences, or ACEs, are important to learn, important to be aware of, and important to stop as much as we can before they get older. So what are some treatments for traumatized children? Well, therapy is always great. It's always first line. Different kinds of therapies are trauma-focused, cognitive behavioral therapy, involving the parent via child-parent psychotherapy, and parent-child interaction therapy. So what we found is children with 4 or more ACEs respond as well to treatment as children with fewer adversities. So even if you have a higher number of adversities, treatment is still very effective. Therapists who follow guidelines carefully typically get the best treatment, or the results. They get the best results. Treatments can improve both children and parents' mental health outcomes, so that's great. It's already hard to talk about how children are affected by these adverse childhood experiences, but for some of these things, dealing with the child or dealing with the situation that they're in, parents have a large amount of stress on them, and so of course their mental health is affected as well. And then finally, treatment appears to restore normal biology and stress response systems in some instances. So again, therapy very effective at maybe there's some sort of biological change that's happened because of the amount of stress from the adverse childhood event. And so therapy can help to actually rectify that. So that's very promising and very good. Some solutions. Mental health recognition is needed to detect and prevent ACEs. The more we recognize these signs and symptoms, the more we prevent them, the better society will be overall. The better these children will grow up to be adults that are better efficiently working within the community, better effective in what they want to do, and hopefully not prone to the different social pitfalls and biological diseases that those with ACEs that don't get treatment or are not prevented or not recognized go through. Psychiatrists trained to deal with emotional sensitive topics. This is so important. ACEs are naturally very emotionally charged, so having psychiatrists that are able to help these people, whether it's through medication or even psych therapy, is key. And then obviously better integration between primary care and mental health. Obviously when you're going through dealing with an ACE, primary care and mental health should be addressed potentially at the same visit, so that way you don't miss anything, because it's so key and so linked together, mental health and just your primary health. We already have talked about how mental health can lead to stressors that affect biological health, that it's important that we better integrate the two categories. And so finally we've gotten to the new study. So this looked at the prevalence of adverse childhood experiences from the 2011 to 2014 behavioral risk factor surveillance system in 23 states. This was published in 2018 in JAMA Pediatrics and was the largest and most diverse U.S. population sample of the studies. And so what are the methods of this new study? what it did was, first, it wants you to identify what is a childhood exposure or experience. Again, these definitions are always good to reiterate at each study because it's important to see if there's any differences and how that affects how we can apply that data. So what they called an ACE was considered exposed to a category if responded to one or more of the questions in that category. And we're going to go through the questions too, so it's very clear. Measure of childhood exposure is the sum of the categories with an exposure. It's going to make a little bit more sense later. And the possible number of exposures ranged from 0, which means unexposed, to 7, exposed to all the ACE categories. So let's begin. We'll go pretty quickly through the ACE questionnaire. It's pretty straightforward. First question, while you were growing up during your first 18 years of life, psychological, you want to know, did a parent or other adult in the household swear at you, insult you, put you down, or scared you in a way that made you think you would be physically hurt? Next, physical, right? So did a parent or other adult in the household push, grab, shove, or slap you, hit you so hard that you had marks or were injured? Sexual, did an adult or person at least 5 years older ever touch or fondle you in a sexual way? Have you touched their body in a sexual way? Attempt oral, anal, or vaginal intercourse with you, or actually go through and have oral, anal, or vaginal intercourse. These, again, horrifying things, but this is things to identify so that we can help them process it and become better functioning adults in the future, not have this weigh them down. Substance abuse. Have you lived with anyone who was a problem drinker or an alcoholic or used street drugs? Mental illness. Was a household member ever depressed or mentally ill? Did a household member attempt suicide? These things are terrifying. As a child, you don't really understand either why they would make the decision or even the concept of death. It's very stressful for the child. It can definitely affect them later on. Whether the mother was treated violently. So was your mother or stepmother kicked, bitten, hit with a fist, or hit with something hard? Was your mother pushed, grabbed, slapped, or had something thrown at her? Seeing a mother getting attacked like this is absolutely scarring for a person's mental health. So this is definitely something to definitely recognize. And unfortunately, obviously, the fact that we're asking this happens, and it happens more often than we ever want to. We would never want it to happen. Criminal behavior in the household. So did a household member ever go to prison? And that's the end of the questionnaire. What happened was we found that there were 10 risk factors acting as the leading causes of morbidity and mortality. These risk factors were smoking, severe obesity, physical inactivity, depressed mood, suicide attempts, alcoholism, drug abuse, IV drug use, and multiple sexual partners, and STDs. And here are disease conditions correlated with childhood experiences, specifically adverse childhood experiences: ischemic heart disease, cancer, stroke, chronic bronchitis, emphysema, diabetes, hepatitis, skeletal fractures, and self-rated health. So results of the new study. When they looked at ACE prevalence, the most common exposures they found were living with a problem drinker or alcoholic, substance abuse, and mental illness. They found that 52.1% of the people in their study had at least one ACE, so similar to the 60% to 64% that we found in an earlier study, and 6.2% had 4 or more ACEs. Here, earlier again, we talked about synergy, and we can see that in graph form. Hopefully this makes things a little bit clearer. So in the study, they found coexisting childhood sexual abuse and household domestic violence ACEs when together are synergistic and actually increase risk of complex adult psychopathology. So this is what I was talking about earlier, where the synergistic effect is greater than the sum of its parts. So let's say we got the red block and the blue block together, and we added them up. Here you can see it's about at a 7 in terms of relative risk and additive interaction. But you can see with the purple block that there's a synergistic effect that actually increases risk of complex adult psychopathology. And here you see the same thing with coexisting parental substance abuse and parental mental illness in males specifically. So again, substance abuse, mental illness on their own combined together come to about a 4 on the scale, but here you can see the synergistic effect is so much more. Continuing discussing the results of the new study, as far as the number of ACE categories, number of risk factors, we found that more ACEs equal increased number of health risk factors. So again, we talked about a lot of these before. 56% of those with no ACEs also had no risk factors, and 14% of those with greater than 4 ACEs also had no risk factors. So it's interesting the way that works. Finally, we're going to go to the discussion. ACEs, it seems pretty clear that the most preventable causes of serious mental illness. These adverse childhood events are, again, scarring. They leave a big impression on the child that affects them for the rest of their life. And to be able to address it early on is so important. They found that ACEs are the most preventable causes of drug and alcohol abuse in women. ACEs are the most preventable causes of HIV high-risk behavior. And ACEs are also a significant contributor to so many leading causes of death, as mentioned earlier. And so again, thank you for listening to this. I hope this has elucidated some of what is an ACE, what is an adverse childhood event. Oh, okay, that makes sense. What is the effect of that going forward? And we can see that it has a huge effect on the child as they grow up to become an adult. Final message is just to be aware of this, not only as a physician, if you're watching this as that, but a provider, someone you see at your daycare, if you see they're going through something or kind of give off that kind of vibe, definitely see if there's a way that the school or your organization or the parent can address it. The child will be much better off later on in their life. So thank you again.